I'm Theresa, and I study the virus that is the most common blood-borne infection in the United States. It is also rapidly spreading in every state across the nation. And it kills more Americans than any other infectious disease. I study hepatitis C virus. Now, the good news is that we can potentially eliminate Hep C completely with 3 strategies. First, we can prevent Hep C from spreading through harm reduction interventions such as syringe exchange programs and safe injecting sites. Second, most people who have Hep C don't even know they have it because a lot of people live with an asymptomatic infection. But we can easily diagnose everybody who has Hep C with a simple, cheap blood test. And 3, finally, as of 5 years ago, there was a treatment developed that can cure everyone who is living with Hep C with a simple pill taken over several weeks. This pill has very minimal side effects and is highly effective. The caveat is that it's expensive. But I believe with these 3 tools, we can potentially eliminate Hep C completely. And that is why I am studying Hep C. I believe nurses need to be part of the solution to eliminate Hep C. So when I started my PhD program, and I decided I wanted to research Hep C, I started with this question: who has Hep C? This figure here shows you Hep C by age and sex in Wisconsin in 2006. What you see is that most people in 2006 who had Hep C were men and baby boomer age people. And the reason why we see so much Hep C among people who are baby boomer age is because the virus was basically spreading for decades before it was discovered in 1989. Hep C mainly spread among the baby boomer population about 20, 30 years ago through mass vaccination in the military, through routine medical practice and procedures, and through unscreened blood transfusions. Baby boomers today still make up the largest group of people who are living with Hep C, and for them, testing and treatment is so important because they are most at risk for developing life-threatening complications in the near future. But when I started the PhD program in 2015, the prevalence of Hep C looked like this. What you see is a brand new wave of people who are infected with Hep C. And they are mainly young adults and fairly equally distributed by sex. Why we see so much Hep C in young adults is due to injection drug use. Injection drug use is currently the main reason why Hep C is spreading and the cause for new infections. And so when I saw this figure early in my career, a couple of years ago, I actually became interested in this group, young adult women. Young adult women have unique health issues when it comes to Hep C, and that is what I'm exploring in my dissertation. But also, there is a 6% chance that Hep C can be transmitted from mothers to babies during pregnancy or in utero. Therefore, it is so important for us to identify pregnant women who have Hep C so that we can test the infants for Hep C, and we can also enroll the women into Hep C treatment after delivery because treatment is currently not approved during pregnancy. The problem is, how we identify pregnant women who have Hep C is through a risk-based screening approach. What this means is that providers need to ask, and the woman needs to disclose whether or not she has injected drugs now or in the past. And what we don't know is whether providers are asking this question. And rightfully so, women may not be disclosing this, because disclosing that you have injected drugs now or in the past can lead to dire consequences, such as stigmatized care, incarceration, and worse, the removal of their children. So, knowing that there is this increase in Hep C among young adult women, there's a 6% chance for mother-to-baby transmission to happen, and that risk-based screening may not accurately identify pregnant women who have Hep C, This led to my first research question, which is, in 10 years, are we going to see a third wave of hepatitis C virus among infants and children? Now, I had the opportunity to explore this question through my policy practicum. You see, as PhD students, we have to do a practicum experience in an area of research, in partnership with an agency in an area that we are interested in. I just want to pause here and say that I think this policy practicum is unique to the UW-Madison PhD program. I did not see it in any other school that I applied to. And for me personally, this experience was extremely valuable. So for my policy practicum, my advisor, Dr. Susan Zahner, who will be grading me in May when I graduate, and so I'm just going to say she's a rock star. She is well connected with the public health community, and so she connected me to the Wisconsin Department of Health and Human Services. So I partnered with the hepatitis C virus team, and I used data from Medicaid and the public health surveillance system to explore the question of hepatitis C virus among pregnant women with Wisconsin Medicaid between years 2011 to 2015. The aims of our study were, 1, to explore the rates of hepatitis C virus infection among pregnant women between years 2011 to 2015, and 2, to describe the proportion of infants who were tested for Hep C among the women who we knew had active Hep C infection during their pregnancy. And what we found was between 2011 to 2015, the proportion of women who had Hep C during pregnancy increased 93%, from 1 in 368 to, in 2015, 1 in 192 pregnancies among a woman who had Wisconsin Medicaid also had hepatitis C virus. That's 1 in 192 pregnancies. Then, only 34% of infants were actually tested for Hep C. And just to be clear, this should be 100% because these infants were born to women with known active Hep C infection during pregnancy. So when this study came out, it was the third study in the nation to show that there is this documentation of the increase in hepatitis C virus among pregnant women. And it was the second study to show the gap in infant testing. So the day after the study was published, it picked up quite a bit of media attention because this is something kind of big going on. In addition, to date, this study has had over 3,000 views, and I have personally seen it cited in several presentations and publications. And this is something that I am extremely proud of, but this study did something even cooler. Because we now have documentation that the number of pregnant women infected with Hep C is increasing, and because we don't know if risk-based screening is accurately identifying pregnant women who have Hep C, there is a national conversation going on right now about whether we should move from the risk-based screening approach to a universal screening approach. This universal screening approach is already being used for similar diseases that have a mother-to-baby risk transmission risk, like Hep B and HIV. And the first evidence of that change and that national conversation going on came out a few months ago. The American Association for the Study of Liver Disease and the Infectious Disease Society of America, which are two national organizations that produce guidance for clinicians, came up with a brand new recommendation for universal Hep C screening in pregnancy. And they referenced this study to show the rationale as why they made this recommendation. Now, what we don't know is whether or not providers are actually following these recommendations. The CDC has not changed theirs yet. But if there's anything I learned from this year's Littlefield lecturer, Dr. Sylvia Trent Adams, is that incremental change is actually how we get things done. So to me, this is really big and really huge. Okay. So I think you all see that I am quite passionate about Hep C. But let me tell you some sad truth. a lot of people don't know about what's really happening around Hep C. I tell my research to a lot of people, and no one has even heard about this disease or even knows what's actually happening. And this is even true for nurses and nursing students. Hep C, and specifically harm reduction interventions, are not traditionally taught in all undergraduate nursing programs. And this is just completely craziness, because not only is this the most common bloodborne infectious disease that is rapidly spreading and very, very deadly, but every nurse, no matter where they work, will take care of a patient who is infected with or who is at risk for Hep C. So now imagine with me. Imagine if we didn't teach our nurses how to hand wash. We still expect them to hand wash, but they wouldn't be properly trained on how to do it. Well, that's what we're doing with Hep C. We still expect our nurses to take care of patients who are at risk for or who have Hep C, but they don't have the proper education to talk to our patients about prevention, testing, and treatment. And let me just remind you that in 10 years, when we did nothing to really talk about this disease, the prevalence of Hep C went from this to this. And I believe if we continue on this status quo, with our nurses not really educated on the ways that we can prevent, test for, and treat this disease, I believe in 10 more years, the prevalence will actually look like this. But with better education, better policies, and better care for those who are living with and who are at risk for Hep C, I believe that nurses can be part of the solution so that the prevalence in 20 years looks like this. Thanks.